Hi, I'm McKenna. I'm an anthropologist. I was given a dream job by one of Michigan's largest public health departments back in 1998. The Ingham County Health Department hired me to complete a holistic analysis of all the environmental issues in the 550 square mile region of Lansing. Go where the data lead you. Even, don't be afraid of offending anybody, even General Motors, they told me. Now, General Motors was the largest corporation in Lansing, and it still is. The health department and myself decided to invite a community roundtable of independent people outside of the reach of the health department to guide the process. They invited people from the MDEQ, Michigan Department of Environmental Quality. They invited a medical doctor, Ed Larkin, a toxicologist, various other officials, and Dave Dempsey. Dave Dempsey was the founder of the Michigan Environmental Council. There were 12 members, 3 from the health department and 9 independent. I couldn't believe what I found. General Motors owned the area's worst leaking underground storage tank plume, located on Townsend Street at their plant. This lust was particularly dangerous because if untreated, it could destroy portions of Lansing aquifer, the source of the area's drinking water. Asthma. Asthma had reached epidemic proportions among African American youth in Lansing, particularly in a place, zip code 48915, located next to 2 General Motors factories. Farm pesticides. Atrazine is a probable human carcinogen pesticide banned throughout much of Europe. But it was Ingham County's #1 restricted use pesticide in 1979, mercury pollution. In 1999, I discovered through FOIA that there were 3 chronic violators of this mercury pollution, including 2 hospitals and a printer. Sewage sludge. My research uncovered that sewage sludge, created from human waste, urine and feces, and banned throughout much of Europe, had become Lansing's preferred mode of fertilizer. Eventually, the first study, called The Story of Water Resources at Work, was distributed by myself to the entire roundtable for their final edits before it went to the printers. I got 2 sets of responses. The independent roundtable, "This should have been published yesterday," Dave Dempsey said. Others said, "This is clear and provocative." I was thrilled until I received the responses from the 2 administrators at the health department. It was nothing but black ink, heavily redacted. Anything sparing of any kind of controversy was just not there. So I had a choice before me. I could either go with, the so-called truth from the community roundtable, the facts, or I could go with the PR document from my 2 bosses. I decided to go with the community roundtable. Subsequently, things got bad. Here's what I did next. Dave and I contacted Peer. Peer provided me with the legitimacy I needed to go forward. They provided me with the support I required to make a convincing public case. And they provided the platform to liberate the suppressed information to Michigan citizens. Peer helped turn the public health into the people's health, something the government had promised to do, but didn't do. They had my back. They'll have your back. When you need them, they will be there. I want to say thank you, Peer, for all of your terrific help.